The Service Employees Union and caregivers are calling on state lawmakers to increase the minimum wage for home health care workers to $20 per hour in the upcoming budget.
Sam Matheny explains why they feel it's needed now and how some lawmakers on both sides feel about it.
I get 25 hours a week on a 70, 80 hour a week job. I can't say no just because I'm not getting a paycheck. That expense comes totally out of my pocket.
According to the General Assembly in 2022, there were 1.3 million in-home caregivers. The state's current minimum wage for those in-home caregivers is $17 per hour, but the Service Employees International Union, caregivers, and some people who rely on home care say the pay isn't enough to meet the need. They're asking the state to raise the minimum wage to $20 per hour.
Over time, what we're seeing is that workers will leave the industry because it's not sustainable for them.
And then the ones that we do have, like myself, have to work other jobs just to make the ends meet.
Democratic State Senator Dave Kaler and Republican State Representative Travis Weaver both call it a bipartisan issue, and they agree that it needs to be discussed in this year's budget.
When you can go to work at a fast food store, and make more money than you can as a home care worker, there's something wrong with that.
And really the benefit that it has onto our system, it's so much more affordable to take care of somebody at their home than it is to take care of somebody in a nursing home.
Some groups are concerned about the negative impacts it could have on home health care providers. Representative Weaver says increasing the minimum wage is only a short-term solution. Long-term, he believes the state needs to speed up the process for health care workers to get their licenses, and more students need to hear about these careers earlier. Lawmakers will meet in Springfield next week to discuss items on the state budget. In Peoria, Sam Matheny, 25 News.